Welcome to Family Awareness Talk Show. In this episode, we're going to focus about the children's health from the birth and the health of the mother. We are going to talk to Dr. Wiam Gool about the health of the children's teeth, since people are always worried about their children's teeth from the time teeth start to come in. There are many important facts you should know about your child's teeth. That's why we have Professor Wiam Gool, a Lebanese Prosthodontics professor, with us. Dr. Wiam Gool, welcome to Family Awareness Talk Show. The first question, when will baby's teeth start to appear?
Thank you for hosting me. In general, the first primary or baby tooth usually comes at about 6 months. Every child is different, but must have all the 20 primary teeth by 3 years old. At around 6 years old, child starts to lose their primary teeth, and from 6 to 12 years old, child has a mix of teeth as baby ones fall out and adult ones erupt.
What are the primary teeth important?
In general, primary teeth have many important roles in the mouth. They give shape to child's face and guide permanent teeth into their right positions. So they are needed for eating, for speaking, and for smiling too. So it's very important to take care of them.
Please tell us about facts people need to know about primary teeth.
There are many facts we should know about primary teeth. First of all, primary teeth have thinner enamel layers than permanent teeth. What is enamel? Enamel is the hard and white layer that covers tooth. This put primary teeth at high risk for tooth decay, especially when the teeth are in long contact with sweet liquids such as milk or juice. Even the breast milk contains sugar. Second idea we should know about that caries or decay or cavities. In general, cavities happen when bacteria and food left on the teeth after eating and are not brushed away. Acid collects on a tooth, softening its enamel until a cavity forms. Third, it is normal for babies to suck their fingers or a pacifier. Most children give up this habit by age 4, but if your child still has a sucking habit after age 4, you should talk to a dentist to prevent problems in teeth development and prevent orthodontic treatment later on.
When should kids must visit the dentist?
The ADA recommends that children should see a dentist by their first birthday. The dentist does a modified exam while the baby sits on mother's laps or father's laps. Dentist explains in this visit the proper brushing and flossing techniques. And these visits can find problems early and help kids get used to dentist visit.
Dr. Wiam, when and why do kids start to have pain?
First of all, kids have the eruption pain. Then, tooth decay can affect child's health and cause pain. It's so hard for child to sleep, to eat, or to speak. The pain can also affect child's ability to concentrate and learn.
What is the treatment that must be followed?
The treatment is different according to each case. Before and in case of small cavity, amalgam was the material of choice for most females. But now, other materials like composite resins are becoming popular because resin is often tooth-colored. But in cases of fracture, big decay or malformation or baby teeth, dentists often use stainless steel crown or ceramic crowns. Sometimes they need root canal treatment to like the permanent teeth. But in cases of extraction and big decay, we should make extraction and space maintainer when the caries ruins all the tooth. Space maintainer keeps the space for the permanent teeth to prevent later many problems and orthodontic treatment.
Dr. Wiam, would you please tell us about the preventions of the follow-up for kids and how to decrease the risk of caries and its attack?
The preventions have many steps. First of all, kids should eat healthy food with high percentage of calcium such as milk, cheese and yogurt. And kids should avoid some sugars, sugary foods, juices, candy, especially the sticky candy that can erode enamel and cause cavities. Baby shouldn't fall asleep with a bottle. Babies who sleep with a bottle of milk or drink, sweet drink, can develop severe tooth decay. Sugar that stay on baby's teeth for hours can erode enamel, leading to a disease called baby bottle tooth decay. So the front teeth are totally decayed and need to be extracted. As soon the third prevention is brushing. As soon as the first teeth appear, brush your child's teeth twice a day for 2 minutes each time with a soft toothbrush and a low fluoride toothpaste. And once they are 6, they can use regular adult fluoride toothpaste. But children need a supervision and help to brush their teeth until they are 8 years old. Let's speak a little bit about fluoride. Fluoride is a mineral that found in water source, in foods, in medicine, some medicines and toothpaste. Fluoride hardens the tooth enamel and prevents tooth decay. You should take your child for regular checkups and good dental hygiene every 6 to 12 months. That can prevent the need for an extensive dental treatment. An important prevention treatment we should speak about is called the Fissure Sealant, which is a thin wash of resin applied on the back teeth of primary and permanent teeth too, and this protective coating keeps bacteria and food particles out of crevices of the molars. But sealant isn't a replacement for good brushing and regular flossing.
Thank you, Dr. Wiam, for the precious information you given to the audience of Family Awareness today.
Thank you and wish you luck.
We have Professor and Dr. Gynecologist, Dr. Samir Al-Halabi. Dr. Samir Al-Halabi, welcome in Family Awareness Talk Show. Dr. Samir, in every episode you have been with us, you have enriched us in many information that you have brought from England, from Canada, and from Lebanon. In this episode, we want to focus on the newborn baby and the care of the baby. Of course, we have to talk about the mother, since she is the one who is responsible for the time of pregnancy and the following up with the medical doctor and the following up with her own born baby. So would you please give us a general introduction about this incident in the family lives?
Hi, Dr. Michael. It's my pleasure to be with you again on the show. This topic, I think, is very important to talk about and discuss everything about it. We have two things. Once the mother delivers the baby, we have two things happening. We have a newborn and we have a mother That is, we want to bring her from the pregnant state to the non-pregnant state. She needs a lot of care, and the baby needs a lot of care. So here we talk about two things I want to discuss them. We have the postnatal period or the postnatal care. This is the period once the child is born till up to 6 to 8 weeks. And we have the postpartum care or period, and this is the time from the delivery of the boy till 6 to 8 weeks for the mother. We have to care for both. But now we will start with the care of the baby. Once the baby is delivered, within 1 minute, we do something called the Upcar Score. This Upcar Score, we look at the heart rate, we look at the respiratory rate, we look at the color, we look at the reflex irritability. These things will give us an idea about the child, okay? And of course, the tone. So a normal child would have a heart rate greater than 100. He will be crying. The color would be pink, not bluish. And he would be having a reflex, and the tone is active. If the child had a score 7 to 10, this means he's a good situation. Mm-hmm. If the score is from 0 to 3, okay, then we need to do resuscitation. And then we repeat this test every 5 minutes for to look at the outcome, okay? It doesn't predict the outcome, but to see how is the resuscitation doing with the baby. This is directly, we're talking about 1 minute, okay? Within 72 hours, the child should be physically examined from the head to the toes. And here we look, especially we give attention to the eyes, if there is cataract in the eyes, or if there is like a retinoblastoma, which is a rare cancer, childhood cancer. We look at the hips to see if there is like congenital hip dislocation. We look for developmental dysplasia of the hip. We look at the heart, we listen. Are there any congenital heart disease? We look at the thyroid gland. So now we are within 72 hours, okay? Between day 5 and day 10, we go into the other level, which we do screening for the child, okay? We all know about the screening. The child, we will do certain tests for him, and generally 5 things they are very valuable. We do them in these screening tests. We look for phenylketonuria, and this is an inborn error of metabolism by which the child will have accumulation of phenylalanine. And this amino acid, if it accumulates, it can cause intellectual problems, mental disability,
wow.
Yes, and seizure. The second thing we look about it is congenital hypothyroidism. We are talking about serious things that if we didn't look, they have a very bad consequences. Congenital hypothyroidism is an important thing to look for because the thyroid hormone produces hormone which is very important for growth. All people know that we have a growth hormone, okay, that deals with the growth. This is right. But the most important one, or plays a very important role, is the thyroid hormone. Without the thyroid hormone, the growth is stunted, it stops. It's needed for the brain development, okay? So it is an important one, and it can be, if we give what causes it, if we can treat it, it prevents us from these things. For example, this can happen if the mother doesn't take enough iodine during pregnancy. So
it's very important,
yes,
so that
each
she
mother,
will be, following the doctor's orders to take these vitamins.
For sure, as she takes folic acid, as she take all the calcium like this, it should include iodine, 150 microgram per day.
Does it differ with the age or any age for the mother?
Any age she should take it.
Should take it.
The other cause that can lead to this congenital hypothyroidism is a defect, or if the mother had radioactive iodine therapy, okay? Or if she is taking antithyroid drugs, okay? Then we go for the third one, we test for cystic fibrosis, It's an inherited disease that affects the lungs and the digestive system. We look for sickle cell disease, and we look for something called the MCADD, which break down the fatty acids in order to supply us with energy. And the child who cannot do them in such a stress situation, such as infection, can be very harmful.
Okay, doctor, I want to ask you, does the mother, the pregnant woman, has to take vaccines during her pregnancy?
Yes, for sure,
Mhm.
for sure. If you want to talk about the vaccine, as the child should receive his vaccination on time, the mother is also recommended to her to be vaccinated. Okay, what we do, first of all, we check if her vaccine record is correct, and and she has taken all her vaccine. If there is any vaccine not taken, okay, it depends on the type of the vaccine, whether we can give it the vaccine during pregnancy or we should give it before. Okay, general rule: any vaccine who contains an inactivated virus or anything inactivated virus can be given during pregnancy. Any vaccine that we call is a live attenuated vaccine, that means we have the virus, but it is weakened. We
Okay.
weaken the virus so that we can elicit an immune response, and yet it doesn't cause us a disease.
Mhm.
Okay, but this live attenuated vaccine, we cannot give it during pregnancy. Okay,
That's really good.
that's
I want
it.
to ask you, what are the risks if the mother doesn't take these vaccines?
The risk is from mild to very severe, and this is a very good question. We should. All pregnant women, I'm saying all pregnant women, regardless of record, during pregnancy, she should take inactive influenza vaccine. She should take the DTaP for pertussis that causes the whooping cough.
Mhm.
We check the mother for rubella. Does it have the antibody titers that can protect her or not? If she doesn't, we should give it before she gets pregnant, at least 1 month. Okay? We cannot give it during pregnancy, and it should take it, if you couldn't give it during pregnancy, it should take it directly before discharge from the hospital. Why? Rubella virus can cause something we call congenital rubella syndrome.
Mhm.
It can cause microcephaly, decrease in the brain, microophthalmia of the
Wow.
eyes. Yes, it can cause cataracts, congenital problems, so it's very severe. It
So
has very
mothers
severe sequels.
shouldn't be careless in this issue. They should follow doctor's orders, and especially the vaccines.
Yes, for example, let's talk about mild condition. For example, all pregnant women should have the inactive
Mhm.
influenza, and I say inactive influenza because we have other type of influenza vaccines that she shouldn't take. We are talking about inactive
Mhm.
influenza vaccine. This will protect the mother because we know during pregnancy her immune system has been modulated. Okay,
Mhm.
some use like the immune system is a little bit down, but I think it is modulated in certain areas and not the other areas. So during her pregnancy, influenza can cause her pneumonia. Influenza can cause her to have preterm delivery before the expected
Wow.
date. Okay, so it can cause the child to be low weight birth.
Mm.
Okay, so that's why it's very important that she take this vaccine. Okay,
Mhm.
in order to produce these antibodies that are being passed to the child so that she can protect him the time that is needed to start his vaccination, okay? The first 2
Yes.
months that is needed. So she provide him with these antibodies, okay? By the way, the pertussis vaccine that causes whooping cough should be taken between 27 to 32 weeks of pregnancy so that we allow these antibodies to be formed and they pass to the child to protect him.
Yes, women must be aware of that.
Yes.
So let's move into afterbirth. So many women actually they don't want to lose a look that they used to have before pregnancy, so they avoid the breastfeeding. What are the most important parts for the child while breastfeeding, and how long they should follow breastfeeding?
Okay, breastfeeding, according to WHO, it is recommended for sure for the first 6 months. Okay, after that, we start to introduce the liquid food, then partial food, then solid foods. But the first 6 months are very important.
Mm-hmm.
It's very recommended. Breastfeeding can last for up to 2 years, and this is very important. Okay.
If it's for 2 years, it's very important.
Not 3 years. Up to 2
Mhm.
years is enough. Okay.
Okay.
So this is the range up to 2
What
years.
what benefits can the mother give to her child while she's giving breastfeeding?
First of all, there is a list about the benefits. We will talk about like the couple 5. First of all, there is this bonding
Mhm.
between the mother and the newborn. That's why we directly put the child on her breast, okay, to have this connection. Giving breast milk to the newborn is so important that the first milk that she produces is very concentrated. It contains the innate immunity like lysozymes. It contains antibodies like IgA, IgG, IgM. It can contain cells like lymphocytes. These
Wow.
are all to protect him because he is not able to produce antibodies during this period.
These are very important
Yes.
information. It's
Yes.
like power. She's giving the baby power to survive.
This is in addition to the nutrients and the important things. And we talked about the bonding. We talked about the benefits of these things, of the breastfeeding. I want to talk something. If the mother did not breastfeed the child, the connection is lost. Research have shown that the mother that does not breastfeed her child actually neglected him during the coming years, okay?
Mhm.
So those who have breastfeed their child, there was a great bond, okay, between the mother and the child.
Maybe the child wouldn't have like a strong connection with his mom if she doesn't give him breastfeeding or enough breastfeeding.
Yes, this is right. Breastfeeding creates this connection between the mother and the child, a great bonding. And I also recommend that after 6 months, once we start introducing the bottle, that the father takes a role in that to bottle feed his child, so that also there's connection between the father and his child. Okay.
Now, Dr. Samir, you talked about the vaccines.
Yeah.
So it's important that the audience would know that the type of vaccines and how they come into category.
Yes. As we said before, that we have the live attenuated vaccine. This contained a weakened virus. It will produce antibodies, but it will not cause any harm. And this vaccine is contraindicated if the person have a low immune system or during pregnancy. The second type is when we have the inactivated, killed, okay, virus. In such a case, we can, for example, give an example like the inactivated poliovirus. Okay, the oral poliovirus is a live attenuated, but the inactivated poliovirus is a killed virus. In such case, we can give him to anybody, okay, because it will not cause harm. The third type is the subunit. We can give example like the PCV 1310, okay, etc. Here we take subunits of the virus, okay, or the bacteria or anything. The last one is the toxoid vaccine. And this is the famous tetanus toxoid or the diphtheria toxoid. Here we are talking about inactivated toxin. The toxin that the bacteria produce, we inactivate it and then we give it as a vaccine.
Mhm. That's really important. You know, sometimes vaccines make fever to the children.
Yes.
Should the parents be worried if the child have fever, they cannot sleep? What they should do?
Yes. Any vaccine have ingredients, okay, from what it's composed. We have certain materials, okay, that are present in the vaccine that can be allergic to some individual and they can be severe. So any person should tell his doctor about these allergies in order to take the necessary actions about these vaccinations.
Yes, I want to ask you something very important, you know, especially in Lebanon and Middle East. When we have newborn baby, all the family from the two sides, from mother's side and the father's side, gather around the baby and they want to hug them and kiss them. What are the risks if they hug and kiss the newborn baby?
You mean now, when we have this
Yes.
COVID-19? I don't...
Before and after.
Yes, yes. Nowadays, it's not recommended at all. They should all wear mask. Even the mother, when she's breastfeeding, she should take care of this issue in cleaning her hands, cleaning the breast, and putting a mask while she's breastfeeding the son.
You don't recommend anyone to kiss the baby, whether they have corona or not. They're not allowed to kiss the baby.
Yes.
They are not allowed to kiss the baby. So what are the guidelines would you give the mother after she has the baby between her arms? From what time till what time she has to keep her eye on the baby?
What guidelines? What you mean exactly?
Like the tips you give the mother, like if the baby wakes up at night.
Okay. About
feeding him, how many times she has to breastfeed him, for example, and all these things.
As we know, we have to talk a little bit about the postpartum period, about the mother, but because this is connected with the child, the mother should take full attention to the child. We said at the beginning that when the child is born, we give him vitamin K. Okay,
Mm-hmm.
this is very important because the child lacks this vitamin K, and we want to prevent the bleeding. Okay, the mother should take care about his eyes, and because during the passage, during delivery, he may get gonorrhea or chlamydia from the mother,
Mm-hmm.
which can cause blindness. So we always give him prophylactic erythromycin ointment or droplets. Okay, and she should take care also of the umbilical cord. Okay, because
Mm-hmm.
once we cut it, we clean it, and she should take care of the umbilical cord not to get infection or like this. She should take care about when she is breastfeeding the child. What is happening during this process? Is he taking the milk? Is he vomiting them? How he is vomiting them? Is it projectile or non-projectile? What is in the milk that is being vomited? And she should directly contact the doctor to do the diagnosis and follow the child as soon as possible. She should take care about the child temperature. During this time, he should not have a very high fever.
Mm-hmm.
The temperature should be dropped as soon as possible, okay? Because we can have seizures in some cases. This is usually the most important thing, and she should breastfeed him whenever he wants, okay?
Whenever he wants.
Whenever he wants.
There's like
2
not
hours,
3
3
times.
hours. Usually at the start it becomes every 2 hours, 1.5, 2 hours. Then the periods start to increase, okay?
Okay, so does the time of breastfeeding increase by the time they grow up, or does it decrease?
It decreases.
It decreases.
We start more, then it starts to decrease.
It decreases.
Yes. And we start to replace it with the bottle feeding.
Mm-hmm. When can we replace it with bottle feeding?
6 months and on.
After 6 months,
Yes.
she have to give breastfeeding plus bottle?
This depends on every woman.
Mm-hmm.
Some women, and here you raise a topic very important. Once we remove the placenta,
Mm-hmm.
okay, the prolactin level increase. The prolactin level and oxytocin are responsible for what we say breastfeeding, how the
Yes.
milk is made, how it's pumped out. So it is very important that we know this concept. And also prolactin has an effect. That's why the woman after, during her breastfeeding, they don't have periods, okay?
Mm-hmm.
Because prolactin inhibit the GnRH, which is gonadotropin releasing hormone. By inhibiting it, you inhibit the release of FSH and LH, which in turn produce estrogen and progesterone
Amazing.
that are responsible for the menstrual cycle. So that's why they don't get pregnant during this period.
As long as she gives the breastfeeding, she doesn't get pregnant.
This is not a rule, but usually you have like 1 month, 3 months. About what you said, the bottle, there is no rule. Some women, they cannot breastfeed the first day after delivery. Some women, the milk start to decrease. So each one has its own case, but usually after 6 months, we start giving.
For the very first days, which is a painful time for the mother to
Yeah.
breastfeed, what does she give the baby if she's not giving the milk? Does it give something like immunity or something? We don't know.
She just give him the bottle that we know about,
Mhm.
the milk that we buy, and she give it. Okay,
It's not risky.
it's
It's not risky.
no, it's not risky.
Some mothers breastfeed the baby every time the baby cries. So shouldn't be they aware if the baby has something else, if they keep breastfeeding him or her while they're crying?
The mother at this time have known the child.
Mm-hmm.
She knows him. She can wake before him in 15 minutes because she got used to it. Whenever he cries, crying alone means he's hungry. Crying with other symptoms and signs means there is something else, and she should visit her doctor, okay?
I wanted to give one last advice to each mother and the father who has a newborn baby.
This is a family issue. I would recommend that the mother be aware and be prepared to have a child, because in the postpartum period, some mothers would go into what we call postpartum blues or depression, because there's a newborn, there's a responsibility, they don't know what to do, she needs support, maybe her husband is next to her. So she should know what's coming to her and the responsibility, okay? And take the appropriate action. The father should be present. And as the mother has a maternity leave, the father should have a paternity leave. The same period should be given to both. The father should be with the son, playing with him, helping the mother, because we know that up to 6-8 weeks, the mother will be returning to her non-pregnant state. She will be visiting her doctor. She would not feel good about herself. Maybe she's fat a little bit. So he should be present next to her and supporting her. Okay?
That's amazing. Dr. Samir Halabi, gynecologist, thank you so much for the amazing information you have given us. Thank you for watching us from Family Awareness Talk Show.